So this is a simulation room where we come in and practice all of our skills that we learn in the classroom and go through a scenario that could happen in the hospital that we might not be able to have in the actual clinical setting. Any nursing class will generally have a simulation sometime during the semester so that you can practice being totally in charge of a patient without having to be responsible for someone's actual life. You can hear their breath sounds, you can feel their pulse. Any type of vital sign that you would do in the hospital, you can do on the mannequins.
I'm going to stay in the room for the first 15 minutes during the infusion, just to make sure that you're tolerating the procedure okay.
And all of the voice from the doctor and the patient are coming from our instructor behind the mirror, so we can't see them, but they can see us. If the patient's having a hard time breathing, you could set them up in the bed or you could give them oxygen. So you can see the ball there goes to the 2 liters, indicating that there's 2 liters of oxygen flowing into the patient. You want to learn how to feel the stress and still be able to do your job successfully and composed. And you can do that with the mannequins. That's good, and you can learn from that and hopefully be better in the clinical setting. That's the goal.
I could zero the CVP to C. The PA would be your CVP though.
Each semester we have 2 classes that are clinical based, and amongst those classes we had different modules assigned to them. So for example, past semester we did wound care and pressure ulcer care. Until we comp out on them, we show an instructor that we're competent in that skill, we're not able to do them in the hospital setting. So by doing them early in the semester, we're able to practice some of the skills that we're going to use in the hospital and then perfect them a little bit better before we try on real patients.
What happens?
Yeah, as soon as disease, or I don't know, what's a disease? This is another simulation lab, but this is for pediatrics. So we have a child mannequin and an infant over here. The baby is completely computerized, which is really handy, so the simulation lab coordinator doesn't have to speak for the infant, obviously, because infants can't speak. And then this patient is still able to talk to us, and we can talk to it through the microphone in the other room. I will be using this semester, my second semester, junior year, as we're in the pediatrics nursing class, and practice our pediatric skills that we learn in class on an actual pediatric mannequin.
In the in-home setting, it brings forth a lot of more complications than you would think, things you wouldn't run into in the hospital setting, for example. So throw rugs are a huge safety concern. If someone's older and doesn't have the best balance or has a walker, those can be huge red flags. Lighting isn't always the best in an in-home setting, not only for the nurses trying to assess the patient, but also for the patient. Chairs, they're kind of wobbly if someone needs help getting up. So when you go into the home health setting, not only are you looking at the patient and how well they're doing, but also you look at their environment and see if there's any major safety concerns. So this room gives us an idea of what that'd be like before actually going to the setting.
So this is a Pyxis machine where we would pull meds for simulations. So we're able to log in, and you would select a patient and the medication that you're going to be giving, and it will open up automatically, and you would remove the medication that you need, how many ever that the doctor has ordered, and close it, and everything will go back to normal. You could remove more medication if you need it, or you can just close out just like you would in the hospital. You wouldn't want to leave it open or anything. And then you could take that medication into the patient and administer it. In the past, paper orders are a thing. Now, not really. Everything's on the computer. So this is new and makes everything a lot more realistic and much more exciting to have the actual equipment that we're using in the hospital.
We recently got a new health assessment lab, all the things we could possibly need for a health assessment. So we look at their ears, their nose, their eyes, we listen to their stomach and their lungs. So anything that you would think of if you were to go to the doctor to get a checkup, we do all of those things and look at the results to figure out what's going on with each person. This semester, second year juniors have the course called Pediatrics, or Children and Adolescents in Nursing. Having little experience with children myself, it's nice to be able to come in here and work with the babies, especially ones that have IVs hooked up to them, because no one's really sure how to hold a baby with an IV, for example. We learned how to do medications with babies, which is a little different than an adult, as you would assume. They can't swallow pills and they don't really swallow liquid medicine very well, so these are different techniques that you're going to use for that. And we're able to practice it with the baby rather than just talking it out. During the afternoons, when they don't have labs, or even during the evening or weekends, this is all available for us to work in. So we could come in here and study, we could come in here and review our health assessment skills, whatever we see fit.